This little insect can fly for up to 6 miles at a time, and it can buzz about as quickly as 15 miles an hour. It's so good at geometry, it can calculate the shortest route between flowers in a heartbeat. They're so smart, they could overthrow the world. Yes, I am talking about bees. Of course, we're all well aware of the bees' plot. That must be what all the stinging is about, right? All right, no, we know that's not why bees sting, but it doesn't change the fact that stinging insects are scary, world domination or not. Plus, they hurt.
Well, the big concern for insects is when patients get stung by a bee, wasp, yellow jacket, or hornet. And those are questions that come up to me quite often during the summer months. And the truth of the matter is that most of these reactions are not severe enough to require medical therapy from an allergist. When you get stung by an insect and you get localized swelling, and what I mean by localized swelling is you can get bit on the hand and your entire arm can blow up. That's still considered localized swelling. Localized reactions occur because there are histamine-like properties in the venom that the insect is stinging in you. So you're going to get a localized reaction like from a mosquito bite or a spider bite or a wasp, hornet, or yellow jacket. It's very important if you get bitten to put ice on the area because it may be painful, perhaps taking an antihistamine or a topical steroid to reduce the swelling.
You should also pull the stinger out quickly. Now, only bees leave stingers. Hornets, wasps, yellow jackets, they don't. So don't be alarmed if you can't find a stinger after being attacked by one of these three. Swelling can last for more than a day, so if that and a little bit of pain in the area of the sting are your only symptoms, then you should be fine. But bee stings aren't always fine for everyone. If you're ever stung more than 10 times at once, call 911. And if you're allergic to bee stings, you should definitely call 911. In allergic people, bee sting symptoms are different and a whole lot worse.
The concern that as an allergist we have is if you get bitten on your hand, for example, and you get generalized hives all over your body, or your stomach bothers you, you feel nauseous, or you feel lightheaded like you're going to pass out, those are issues that must be brought immediately to your primary care doctor and then be sought out by an allergist. The fear is that it creates an immune reaction in your body that causes a generalized allergic reaction where a medical protein called IgE is released, and then you get organ systems that aren't even where you got stung involved, such as your stomach, generalized lightheadedness, nausea, lip swelling, tongue swelling, the signs of anaphylaxis, which is a full-blown allergic reaction. These would need treatment immediately in an emergency room, and you should then be equipped with an epinephrine pen or an EpiPen.
If any of these anaphylaxis symptoms crop up, get to the hospital immediately. Taking an antihistamine can possibly slow the anaphylactic reaction, but not stop it. And if the victim is allergic and doesn't have an EpiPen with him, do not wait for the symptoms to appear. Just call 911. And if you're allergic to bees and you didn't know it before the sting that took you to the ER, and after you're all fixed up and free to go home, there's one more thing you have to do before you get back on that horse. Go outside and face the bee.
Have to know to go seek out an allergy evaluation when they've had a bite that's severe enough to cause them to go to the hospital. It's very important to take that next step, and sometimes your local doctor or the ER doesn't guide you in that direction, so patients have to realize that if they do get stung by an insect and have a systemic reaction, meaning more than just a localized reaction where their skin was bitten, they need to go seek further attention with an allergist.
An allergist will hook you up with an epinephrine pen, the EpiPen we mentioned, which are only available by prescription. Then whenever you're going outside, be sure to carry the EpiPen at all times. It's a small little pen-like injector, but it can reverse anaphylaxis in minutes and even save your life. I guess between tiny bees and small EpiPens, it's true what they say. Big things do come in small packages. I'm Dr. Mike Rosen, and you're watching the eHealth Network. See you next time.